It's hard to find anyone who enjoys going to the dentist. Regular visits are important for oral health, but a dentist visit can be stressful and sometimes expensive.
And do you always need those recommended procedures? Consumer Reports takes a look at 5 common dental procedures to help you figure out if and when you really need them.
Sitting in a dentist chair, the last thing you want to hear is that you need a filling, a crown, or a root canal. But do you always need every procedure that's recommended?
There's a lot of gray area in dentistry, and there's not always one right answer for a given problem. Some dentists may also pressure their patients to get more expensive treatments, so that's why it can be wise to get a second opinion.
In fact, only 27% of people have ever gotten a second opinion on a recommended dental treatment or procedure, according to a recent Consumer Reports survey. CR sought the advice of dentists to find out what you should do if you're told you need a procedure. Take a routine procedure like a filling. Replacing or repairing a filling can be important when they're damaged, but be wary if your dentist recommends replacing them simply because they're old.
Age alone should not be the only reason for new fillings, so push back if your dentist recommends replacing your fillings just because they're old.
If your dentist recommends a root canal, make sure they perform the adequate testing, which may include x-rays and a sensitivity test. And if your dentist recommends pulling a tooth, consider asking if there are other ways to extend the life of the tooth, because an implant can cost you thousands of dollars.
A tooth extraction is generally the last step for a damaged tooth, so if your dentist recommends an extraction, ask them to explain why and consider getting a second opinion.
To find a dentist for a second opinion, CR recommends asking friends and family or searching on the American Dental Association site. And be sure to ask for your records, including x-rays, to give to the second dentist.
When you do ask for your second opinion, you don't need to explain what the first opinion was, so the new dentist can examine you without any preconceived notions.